So now that you've heard about how to advocate for yourself in different situations, I wanted to share a new way that FCF has for you to participate in advocacy for Fanconi anemia, and that is the FA Patient Advocacy Program. So first, I want to start with a little bit of background. Some people may have heard of the concept called patient-centered care, and that is something that started to develop with the intention of shifting healthcare from disease to centered around patients and their families. And so within this, the same concept started to become more popular in research in 2010. And then when the 21st Century Cures Act came out, then they started to include the patient perspective in the FDA drug development. And to date, they continue to release new and updated guidance. What they have done is moving patients from the subjects of research to partners in research. And what they found was that their outcomes, they improved recruitment and retention, shortened timelines, and then improved clinical research outcomes. So with the FA Patient Advocacy Program, we hope to create a platform where your voices can be heard. And we realize that with FCF that our mission of advancing research cannot be met without our patients. Just to start off, who can be an advocate? We include adults with FA, parents of children with FA, caregivers, and bereaved family members. And how can advocates be involved? So there's several different ways that we're utilizing advocates. So to start off in research, so you could work with researchers to work on study design and logistics, to give them feedback and advise them on participant burden. You could work between the researcher and the FA community, helping them to disseminate results of their research. And I'm actually really excited to say that we have advocates actively working on all of these different types of projects right now. In the legislative and regulatory areas, you could be working with state and federal public policy initiatives or with regulatory agencies like the FDA. You could be a patient representative giving your experience with FA. We also work with other rare disease organizations such as EveryLife Foundation, Global Genes, and NORD. And in those types of places, maybe you could go attend other conferences, give talks, just meet other people with rare diseases. And then within FCF, we have different committees or scientific and educational meetings that advocates can take part in, give testimonial. And then other special projects, like we have guidelines chapters that we could have advocates help edit. So within the advocacy program, once you're signed up, then we offer some training opportunities. So all advocates will go through a storytelling for advocacy, and then as needed, as you get signed up for different projects, then we have some training on research advocacy, things like drug development, legislation and policy, and even media. And then how it works. So if you become an advocate, then you are in this pool of people. So right now we have 22 advocates in our first cohort, and on the website we have an advocate request form. So that can come internally within FCF. It can be external researchers, industry partners. They complete a request form with the information on their projects, their needs, what kind of experiences they would like their advocate to have. I take that and match it to an advocate. So whenever you apply for the program, you tell us what are your interests, what are your experiences, so then I can match you up with projects. I check in occasionally to see how the project is going. And then at the end, we have some evaluations between the advocate and also the project managers to see how it went, what the advocate's actual impact was, how the researchers treated you. Did you feel valued? Did you feel heard? Then we can adjust training and other resources accordingly. So this is a graphic from our partners, Living Proof Advocacy, and that's who we are utilizing for our storytelling training. I just really like this because it shows the whole path to advocacy. So everybody is somewhere along this spectrum. So maybe you were at the beginning. Maybe you were just recently diagnosed and telling your story sounds really scary and overwhelming. And I know that we have people in this room that are on the other side of the spectrum that will stand up here and tell their entire story, take the mic from me, start to finish. Michelle, I know. Yep. Jump up here and just be ready and not, even think twice about it. So at the beginning, it all just really starts with your lived experience. You may be just processing that experience, kind of exploring what that feels like, thinking maybe you'd like to share your story, but you're not sure. And then when you move on to the next part of, okay, I think I'm ready, to share publicly. You still might want to think through, what are risks and benefits, because sharing your story is really vulnerable. Once you get to the point where you've decided that you're ready, you may want to think about defining your advocacy. So we all know that FA touches so many different pieces of your lives. So some people think about what you're really passionate about. It might be mental health, it might be cancer, it might be research. Who is your audience is the second part. So do you want to educate clinicians? Do you want to work with researchers? Do you want to talk to donors about raising money to fund the research? And then, so once you've kind of decided what your area is, then the advocacy program comes along, because we're going to help you develop the skills to be able to do that effectively. We will help you, like I said, with crafting your story to certain audiences, practicing and reflecting. And what that does is takes you from, you're starting within yourself, your lived experience, and then that's going to help move you into showing that to others and utilizing your lived experience to make change. So your plan may be, I want to tell my story, and then we're going to move you into the action of being an advocate and actually being able to tell your story. Okay, so I can stand up here and talk all day long, but I think it's most helpful to hear from a fellow adult with FA. So Anna Tabar has completed our training. She was in the initial cohort, and then she went on to train as a storytelling coach. So she's going to be helping us to train future advocates and work with some of our international advocates. So Anna, if you don't mind sharing a bit.
Thank you. Thank you. I think everything was very, very well explained here. I just want to share a little bit how it was for me. As you may know, I'm from the Dominican Republic, and with my family, we have a fund in the DR. So for me, it was very difficult, like, to know what will be the best audience for our foundation, because sometimes it's difficult to share the correct part of my story when I'm talking, for example, with the families, and then I just need to jump to talk with the medical in the Dominican Republic, and then I just want to talk with the patients. So sometimes that part is very difficult because you don't know how exactly or what part of your story should be worked the best for one of the areas. So I think that part was very helpful for me because they show me how to craft my story for each individual or each part of the medical team or the families. So that was very important. And it was also very important for me to understand that if I want to have an impact, I will need to choose the right words, and it should be short. Like, sometimes we want to share everything, and it's very difficult because we can start talking a lot from the beginning to the end, and sometimes the best results will give us, it's gonna be when you just share one part that is interesting to that person. Also, I think it's very important for us to advocate for ourselves. And for example, in my country, it's very difficult to find a good doctor who can be interested in this weird disease. So that's why I invite, for example, the Latin American community to start sharing their stories, because in that way, I know it's difficult because you need to talk a lot about your feelings, about all your story, but in that way, we can, let people know what it is to have Fanconi anemia. So I invite you to join to the program and start talking more about our experiences, and maybe we can change the world doing that. Thank you.
Thanks, Anna. So I just wanted to end with, here are some of our advocates who are with us this weekend. Some of them couldn't be with us. Like I said, we have 22 in total, but feel free at any point to chat with me, any of them, about how their experience has been thus far. We also wanted to express our sincere gratitude to the Joel Walker Fund, especially Nigel and Ann Walker, for their generous support of the program. And if anybody is interested in joining, you can talk to me. And we also have an advocate application on our website. And when you go to the FCF website, it's under the How to Help tab. So does anybody have any questions? So right now we have a break. So there'll be snacks in the lobby. Following the break at 3:20, there'll be a support session for everybody with Nancy in Carolina A, which is across from the lunchroom. Thank you.